Hi, welcome today. Really nice to have you. I'd like to start off, I'll introduce myself. I'm Jackie Hughto. I'm an associate professor at Brown University and one of the scientific advisors on the T2 core, the Transformative and Translational Research Core for the COBRE on opioids and overdose. It's lovely to have a conversation with you.
Yeah, thanks for the invitation. So I'm Patrick Kelly. I'm a fourth year PhD candidate in the Behavioral and Social Health Sciences PhD program here at the Brown School of Public Health. My research focuses on the psychosocial and structural factors that affect how people make medical decisions, especially in the area of drug use and sexual health, primarily among people who use drugs as well as the LGBTQ community. So it's really fascinating to be here having a conversation about this important and timely paper.
Great. So Pat, I'm really interested to hear more about your fentanyl pathways paper. It's a very interesting study, and I'm curious if you can share why it's important to focus on people who are incarcerated, specifically for manufacturing and distributing drugs in the context of the fentanyl epidemic.
Yeah, absolutely. So in the current wave of the opioid crisis, what we really see is a growing involvement of stimulants in opioid overdose deaths. And so that leads to questions around how exactly is that happening? The challenge is when we speak with only folks who are intending to use either stimulants or opioids, it doesn't give us a complete enough answer to explain how in mortality data we see the contribution of stimulants in these deaths. And so that leads us to think about, is there something happening on the supply side that might in part help to explain and importantly identify modifiable factors that we can act on in terms of public health to help reduce some of these deaths. And so that led us to getting to this interesting study where we had the opportunity to go into the Rhode Island Department of Corrections to speak with people who are incarcerated for manufacturing and distributing drugs to understand their perspectives on how they felt that fentanyl might be ending up in the stimulant supply, whether that be intentionally or through accidental pathways.
Okay. And so how come you went to the Rhode Island Department of Corrections versus talking to people who are distributing in the community?
That's a great question. So in thinking about our sampling frame, we wanted to reach folks who felt like it was safe to talk with us and who also were knowledgeable about the supply in ways that folks in community might not necessarily be. Mm-hmm. As part of this study, we did speak to people in community, and it was evident that they had some speculation about how this might be happening, but we weren't really tapping into that greater level of knowledge that we were hoping to get at. And so when we were able to establish this partnership with the Rhode Island Department of Corrections, pretty quickly it was evident to us that we were tapping into a pool of knowledge with folks who had a much greater appreciation and lived experience with higher levels of the drug manufacturing and drug distribution network to provide some interesting insights.
Interesting. Well, I'm looking forward to unpacking how you did that, but I'm curious if you could just, for the audience, can briefly summarize the main takeaways of your study.
Yeah, so when we interviewed folks, there were sort of two main pathways that people conceptualized in terms of how fentanyl might be ending up in stimulants. The first of which are through unintentional means, and that was really the primary pathway. Folks articulated that there are contamination events where perhaps folks are moving too quickly as they're manufacturing their drugs, or perhaps they themselves are using drugs, and that increases risks of error. And essentially in these workstations where drugs are weighed out and packaged, there's contamination that actually one participant likened to E. coli contamination. Think about what might happen in a kitchen. Then we heard from folks that there might be accidental missales of product where someone might be intending to sell cocaine, but they accidentally sell fentanyl because these products appear similarly. Then we did hear from some folks, they speculated that perhaps people are motivated to intentionally add fentanyl to stimulants. But it's important to stress that this was really presented in a speculative nature and not based off of firsthand accounts or anything that these participants had witnessed. And so what that tells us is that participants were essentially retelling longstanding misconceptions about how fentanyl is ending up in stimulants that we see play out in the media. So for example, some folks reiterated the perception that fentanyl is intentionally added to stimulants to increase a person's profits by establishing a customer base who previously was not dependent on fentanyl, but who now is, and therefore has to spend more money because of their physical dependence on an opioid. But that really didn't play out in the data, which I think is quite interesting in contrast with the media narrative, which I know that we'll talk about in a bit.
Yeah, I mean, it's definitely something we see in the media, these kind of fear tactics around who are distributing or putting fentanyl into the drug supply, into the stimulant supply to get people hooked. And we've definitely heard that on the street. Some people think that may be happening. So I'm curious specifically how your research has like challenged that narrative. Like what made you feel more confident about what participants had to share in terms of how fentanyl is accidentally getting into the stimulant supply? Can you tell me a little bit more about those processes?
You know, it is really quite interesting because we did have a considerable number of participants who regurgitated some of those myths and really strongly did endorse them. But when it came down to it, didn't necessarily have the experience to back that up. At the same time, we heard from folks who were, you could consider them to be more senior, kind of having greater familiarity with the drug trade, which we measured in the sense of thinking about their income, their overall exposure, and essentially their role in operations and kind of length of time in the game, if you will.
Yeah.
And so what we heard from these folks who had that sort of credit was that larger organizations that are going to be manufacturing these drugs don't have an interest financially in diluting the drug market. It makes sense from a financial perspective to maintain a drug market of folks who are seeking opioid product and those who are seeking stimulant product. When you cross paths in that way, you dilute your business potential, right? The other thing was perhaps obvious, but it just doesn't make sense. If you have a customer who's intending to purchase a stimulant from you, we know that stimulants are associated with psychoactive effects such as like just being energized, right?
Right.
You're not necessarily going to be someone who is then looking for an opioid which has a downer effect. So there's that keeping your customer happy incentive. And then of course there's legal repercussions as well, right? It carries great risk in terms of homicide in some cases. If someone who purchases your product accidentally fatally overdoses, right?
Yeah.
That's extreme risk for you to take on as a person distributing drugs. And so for those reasons, it became quite apparent that despite the media speculating and even the court of law kind of insisting, oftentimes without significant evidence, that folks intentionally adulterate stimulants with fentanyl, that really might not be the case. And it's really these unintentional pathways that are at play. And importantly, things that are in people's control.
Okay, interesting. Yeah, because, you know, within Rhode Island, there is the drug-induced homicide law.
Yeah.
So people can be held legally accountable if they were to sell a product that someone ended up overdosing on. So it does seem like it would be in the best interest of the distributor to try to keep the products separately. And so that's interesting that that's kind of what people had to share.
Yeah, and you know, when you really look into it and kind of get into those cases, and even in the media, the word laced comes up so much.
Yeah.
But then when you unpack that, there's never kind of weight behind that, right? How do you understand someone's intent? Well, you really can't unless you speak with them like we did.
Yeah.
And when we did, we found that that was not the case.
Yeah. Yeah, absolutely. Can you talk to me a little bit about the human error aspect? And then you talked about the mix-ups, but can you kind of give me an example of like how this may actually occur on the ground, some different scenarios related to that?
Yes, for sure. One thing that's important to note is that we were able to speak with folks who were involved at different levels of drug distribution specifically, right? And so you might think of, there's folks who are suppliers who might move product in greater weight, right? They just have more to move. And so they are then selling off product to folks who are in turn selling it off, who are then just kind of running the product on the street, right? What we heard was the folks who were closer to the street, the literal corners, were also folks who oftentimes use the supply. That introduces the potential to alter someone's state, and that in turn can introduce opportunity to make mistakes when you're distributing product that looks alike. We also heard from folks that there's potential concern with regard to intentional contamination, that folks are motivated by perhaps profit to do that, especially folks who are kind of on the street who might themselves be in transitional housing and really might be looking to make some money. We also heard at the higher level in terms of manufacturing that folks can get wrapped up in the profit of it all, and what essentially was characterized as careless business practices where folks aren't thoroughly disinfecting their surfaces, if they are folks who are manufacturing stimulant product and opioid product. It's important, just like you would in any business, to have quality control. It was apparent from our data that not everyone is doing that.
Okay. So when you're saying like on the street level, let's say you're dealing dope, it's fentanyl, it's a white powder, and then you have cocaine, white powder, and is it just a matter of you give out the wrong bag by accident? Is that a situation that folks described?
That is a situation that folks describe. In fact, we had one participant who had the inverse of the situation where someone who was purchasing drugs from him intended to buy fentanyl, but accidentally this distributor sold this person a stimulant.
Okay.
When we think about physiologically how that looks in the body, of course, anytime you give someone something that they did not intend to take, there's a problem and inherent risk involved with that. This particular client did not experience the downing effect given that they used a stimulant. Regardless, though, it exemplifies how these accidents can happen, because the powders looked alike. Of course, the participant conveyed extreme remorse and understood through the retelling that's included in the paper the risk that could have come with if it had been the inverse, where the client was someone who used stimulants and he accidentally sold fentanyl. Well, people who use stimulants and only intend to use stimulants don't have a physiological tolerance for opioids, and therefore at much greater risk of a fatal overdose should they be exposed to fentanyl.
Right, and if they're not expecting it, right?
Exactly.
And so similarly, when you were talking about kind of the surfaces, someone say cutting something up, on a scale, that there's residue, and that could be sufficient for, someone who's opioid naive to potentially overdose if it enters the stimulant supply that's also on the same surface.
It could be, yeah. I think that also is an area where future inquiry is needed as we think more specifically about how folks learn to manufacture drugs, kind of what are the touch points in which risk can be introduced, because that answer will tell us where can risk be reduced, right? I think there's outstanding questions that have yet to be answered, but that's one of the exciting things about the paper, in that it was exploratory in a way that helped us to challenge some of those existing myths and sort of steer us towards exciting frontiers in harm reduction, right? And thinking about perhaps even educating folks about best practices when it comes to things like drug cutting and manufacturing.
Okay, yeah, that sounds like a good new pathway.
Yeah.
I'm curious, so, you talked about kind of what's been said in the media and maybe some of these myths. Why do you think these results are so important, and how do you think they should be disseminated to the media to potentially correct some of these misunderstandings about how fentanyl is entering the stimulant supply?
Well, first, I think that it's important to give people a voice, and qualitative research can really do that. And when we think about this particular population, I mean, these are folks who were incarcerated at the time of participation, and these are also folks who are demonized in society and presumed to essentially be ruthless and kind of not really care about what they're doing. But when you speak with folks, oftentimes they're motivated by trying to care for their family, to provide for their community. And when you get into it, they're able to make a lot of money and really do tend to look out for the communities in which they come from, right? It underscores why it's important to sit down with someone and have a conversation to understand their firsthand perspectives, because once you do that, it starts to challenge the bias and the stigma that persists in media that ultimately can be used to really advance things like the drug-induced homicide laws, right? And so the findings of this paper really show that there is too much of an emphasis on intentionality and this idea that folks are intentionally adulterating the stimulant supply with fentanyls for nefarious means, when in fact it seems that perhaps there's greater question around what are the forces that are causing all these mistakes to happen? Why are folks experiencing so much pressure? What's the hustle that's happening here? And then also I think the emphasis really needs to be on shifting away from criminalization and thinking about harm reduction at a level that's not just considering people who use drugs, but people who are distributing them as well. They're able to have an outsized impact given the role that they play in shaping the drugs that people eventually consume.
Yeah, that's a really good point. You brought up the criminalization piece. We talked about the drug-induced homicide law, but one thing that struck me in reading the paper, right, is that there's people who are distributing, but many of them also have a history of using drugs themselves. And so when you think about this potential for accidental contamination, do you have any thoughts on kind of how concurrent drug use may shape, the risk of those kind of mix-ups?
Mm-hmm. And I'm glad you brought that point up because it made for an interesting element to the data where folks were able to sort of understand the perspective of people who use while they're also folks who are running a business. Mm-hmm. And I think any good person running a business would like to be able to see themselves as their consumer, right? Yeah. To inform their business operations. And so, I mean, that's definitely what we saw. And so we heard from folks that when you're staying up late at night trying to manufacture your drugs, or perhaps you're more on the distribution side and you're kind of running, well, you might be inclined to use some stimulants to keep you awake so you can either make back the money you might owe someone or just kind of keep the profit flowing. When that happens, you might be sleep deprived. You might just be more likely to make mistakes, honestly.
Yeah.
And then, of course, with the introduction of other substances like opioids or like alcohol, and then when you consider the role of polysubstance use, it just kind of creates a perfect storm in which people just really aren't on their game. Not only did participants kind of characterize this as sloppy, was someone's language, but that there is this maybe risk tolerance that's introduced, sort of where you are in an altered state and you're just kind of moving so fast that you might just kind of be a little bit more careless with your actions.
Yeah. So again, another potential intervention.
Exactly.
Point. Yeah. In thinking about the criminalization piece, we often hear, especially from law enforcement, okay, we're going to go back after the quote unquote dealers, the bad guys, but the fact that your participants had a history of both dealing and using, it's not such a clean line after all, really, And so I think that's a really important piece to elevate as we think about these results and how we define the populations that we're working with.
Exactly.
You went into a Department of Corrections and you talked to people who had been charged and sentenced with drug distribution. How did you do that, and how did you get them to talk to you?
There were a lot of logistical elements that had to be kind of ironed out to make sure it went smoothly. But when it came down to it, folks were pretty willing to speak with us. For the folks that we contacted who were available, we had no refusal rates.
Wow.
The only time we weren't able to reach folks were if they had been, they were doing something else and it just didn't align with our time, or they were released during the period of time when we attempted to make contact. Part of it also meant that when we made that first encounter, just answering as many questions as possible, a lot of folks were just generally interested and kind of viewed it as an opportunity to right a wrong in some ways. But I would also say that the certificate of confidentiality, kind of getting on the more technical aspect of things, which really helps to protect participants' privacy. What is shared with us from being entered into a court of law, unless the participant was to consent to that, that helped to show to folks that, okay, these folks are legit and they understand kind of the risks that are involved with this. And they're kind of looking out for me in a way that makes me feel like I can speak openly. And I have to tell you, they were really interesting conversations. You can even see it in their body language. I remember lots of times folks sitting cross-armed and then they'd lean in across the visitors table and just get excited because most folks never have an opportunity to speak about this, let alone be paid to speak about it. Folks were compensated $20 in their commissary account for completing an interview and $20 for completing a survey with us. And so we were cognizant of compensating them for their knowledge.
That's great. Well. And they're experts in their own lives.
Exactly.
And so it sounds like then the Rhode Island Department of Corrections had to be pretty supportive of, to create the space for you to do that. And what kind of environment were you in? Like, what was the space? Were you in a cell? Were you in a, lobby? Like, what did that look like?
Yeah. So, we actually had the opportunity to go to several kind of facilities within the Department of Corrections, but it was always in a secured area, like a visitor center, essentially. The warden would kind of call folks down, and then we would have a CO, a correctional officer who would essentially kind of escort people over to us at the visitor's room, and it would just be a normal conversation. Where most of our interviews occurred, they also have a program where folks who are incarcerated can train puppies to be service dogs. And so it was pretty common for us to just be surrounded by puppies
Oh, wow.
undergoing training
Yeah.
while these interviews were happening. And
Yeah.
so it really was not some frightening thing.
Yeah.
It felt quite normal and accessible
Yeah.
as well.
That's great.
Yeah.
That's good. Sounds like a perfect environment. I'd love to collect data around puppies any day.
They really liked it. I mean, they spoke at length, in between the research procedures, just how much, working with the dogs brought something to their days. So
That's great.
Yeah.
That's awesome. So, okay, final question. I mean, you've talked and kind of alluded to the potential for intervention, but I'm curious, having collected the data, what are one or two kind of intervention strategies that you could perceive in terms of harm reduction based on the findings of this work?
Yeah. Well, I think there's a lot, but one that perhaps is most immediate is the fact that when we speak with both people who distribute drugs and people who use drugs, they often say that they're always having conversations, right?
Mm-hmm.
And especially when you speak with people who use drugs, they say, well, I know I can trust the supply because I've talked with the person who I bought it from.
Yeah.
So that right there is a touch point, right?
Mm-hmm, mm-hmm.
What's happening in those conversations, and how can we think about making the use of fentanyl test strips known to folks who are selling drugs so that they can have a more informed conversation with folks who are then purchasing the drugs. So perhaps it's a conversation about making sure that folks know that these test strips are available so that then they can say, I've tested my product and I can tell you that at least at the point of sale right now, it doesn't contain X, it has Y. Then we also can think about the use of drug checking services at harm reduction organizations, for example. That was something that we asked folks who were incarcerated about. There were mixed opinions, but I think it's an important frontier for us to start to consider as we think about scaling up the use of that tool and shifting, again, how we think about harm reduction, broadening it to include folks who are distributing drugs. Then I also think the third strategy that folks actually kind of got excited by and thought would be useful would almost be a bit of a recipe book or a how-to in how to safely manufacture drugs in the sense of avoiding the contamination events, cleaning your workstations. And that really came up because when we spoke with people about how they learned how to cut drugs, it was all over the place. But they were taught by someone most often. Some folks looked online and things like that. And so that tells us that folks look to learn how to do this and that folks also have a vested interest in doing it well so that they can quickly build a reputation of providing a safe, clean product.
Oh, wow. Well, great. I mean, I think those are all amazing ideas that are just evident. I mean, they're informed by the evidence, right? And that you actually talk to people who would be engaging in these practices and got their buy-in. And that's a really good place to start as we think about ways to keep people safe while they're using drugs in a very unknown and often chaotic, drug supply. So thank you so much for your work. It's been fascinating to learn about the data collection process, what you learned. I think these are great methods that hopefully others can employ as we continue to do this work. So
Absolutely.
appreciate your time today.
Yes, thank you for the invite.
All right, take care.
Thanks.